Hello my dear doctors, right, I would like to discuss important topic, right, the dementia. Dementia is thought to affect over like the 7 lakh people in UK and accounts for a large amount of health and social care spending. And the most common cause of dementia in the UK is Alzheimer's disease, followed by avascular and Lewy body dementia. So yes, AD, then VD, vascular dementia, or we call the multi-infarct dementia, and lastly Lewy body dementia, LBD. These conditions may coexist, right? And the diagnosis can be difficult, but is often delayed. The mini-mental state examination is widely used. A score 24 or less, circle 24 out of 30, suggests dementia. Management in primary care of the blood screen, alright, is usually sent to exclude the reversible causes like hypothyroidism. Alright, and I recommend the following test, that is FBC, urea electrolytes, LFTs, calcium, glucose, TFTs, and also the vitamin B12 and folate levels. And the patients are now commonly referred to old age psychiatrists and also sometimes working in memory clinics. In secondary care, neuroimaging is performed to exclude other reversible conditions like the subdural hematoma, circle hematoma, as well as and also the normal pressure hydrocephalus, so hydrocephalus, and help provide information on etiology to guide prognosis and management. 2011 NICE guidance, so structural imaging was said to be essential in the investigation of dementia. So my dear, listen very carefully. I'd like to give the box of SS box, that is dementia. So yes, dementia is a deleting mentia, means the memory, alright. So dementia. The most common cause of dementia is an Alzheimer's disease, vascular disease, then Lewy body dementia that we call the LBD, alright. So this is the most common, this is the second most, this is the third most common, alright. So we can write the first box. Second box is said that the diagnosis of dementia diagnosis less than, alright, is written the 24 score, less equal 24 out of 30 in a mini mental state examination. So that is the dementia. And it is said that the management includes of dementia means the investigations in a primary care. Dementia investigations. If you write investigations. So in a primary care, at least the correctable causes should be investigated. So that is written that the FBC, alright, then the kidney function, urea electrolytes, then LFTs, then the TFTs. So urea electrolytes we can write that the renal function test, RFT, along with the calcium, then glucose, alright, and along with the vitamin B12 and folate levels, alright. So write a box, alright, that will be helpful. So these are the function tests in a primary care that you need to do, alright. In a secondary care, right, it is written that the imaging should be done like CT or MRI should be done, at least, alright, some structural diseases, or at least the 2H should be thought about, that subdural hematoma, SDH, and H for, yes, normal pressure hydrocephalus, NPH. So make a box, and make a box. And I'd like to discuss another topic, that is the Alzheimer's disease. Alzheimer's disease is a progressive degenerative disease of the brain according for the majority of the dementias in the UK. Most cases are sporadic, alright. We don't know actually why this is happening, alright. 5% cases are inherited as an autosomal dominant. So circle 5% AD autosomal dominant. Mutations in the amyloid circle precursor protein in chromosome number 21, presenilin like 1, and also the presenilin 2, chromosome 14, chromosome 1 genes are thought to cause inherited forms. An apoprotein E, allele E4, anchors a cholesterol transport protein. So circle apoprotein, circle. Pathological changes, the macroscopic, the widespread cerebral atrophy. So circle atrophy, particularly involving the cortex and hippocampus. So circle cortex and hippocampus. Microscopic, there is intraneuronal neurofibrillary tangles. So circle tangles. Neuronal plaques and deficiency of the neurons. Biochemical, there is deposition of the type A, circle stay, beta amyloid protein in the cortex, deficit of acetylcholine, circle, from damage to an ascending forebrain projections. Neurofibrillary tangles are paired helical filaments are partly made from a protein called tau, circle tau. In ADR, tau proteins are excessively phosphorylated. Management includes the NICE recommends that the 3 acetylcholine receptors inhibitors like donepezil, galantamine, and also rivastigmine as options for the managing to mild to moderate Alzheimer's disease. Memantine, yes, the NDMA receptor antagonist is reserved for the patients with moderate to severe Alzheimer's. So I'd like to give a box, my dear. These boxes are really, really helpful. Let's start with the SS box. Alzheimer's disease is itself is an autosomal dominant disease, but these are only the 5%. And because of this, Alzheimer's disease is raised, so I encourage to talk about the rule of A's that will be helpful. It is written in your notes some of the points that we already write. So A stands on the amyloid. Yes, just write it down, amyloid. Precursor protein. Yes, amyloid precursor protein. Just write it down, which is in the chromosome number 21. And this PP precursor protein will be helpful. Presenilin 1 and presenilin 2 once again, and chromosome number 14 and chromosome number 1. Alright, so amyloid precursor protein, presenilin 1 and presenilin 2, alright, that is helpful, alright. So these are inherited forms of autosomal dominant, and also A for apoprotein is written the apoprotein. Once again, apoprotein, E allele means the E4. Just write it down, transport protein. Some of the pathological changes you see, right? So this is the bundle pack of A. Another bundle pack is that you see the atrophy is the pathological changes. The macroscopic pathological changes, the atrophy, particularly the cortex and hippocampus. So yes, so atrophy is the main point, is the atrophy. Microscopic is the neurofibrillary tangles, alright. So neurofibrillary tangles, I am saying the neurofibrillary angles, no problem. If I write the neurofibrillary tangles, I am writing angles, any problem? So T. So rule of A, right, microscopic and biochemistry had showed that. You see the biochemistry, say that the another A, there is type A, beta, amyloid, protein. In the cortex, deposition in the cortex. plus, you see, plus acetylcholine deficiency, alright, from the damage to the ascending forebrain projections. Why? From ascending forebrain projections, alright. Once again, the neurofibrillary tangles or angles, I say the angles, is nothing but the helical filaments are partly made from a protein called A for angles, A for, if I say the tau protein, this is nothing but the tau protein, tangles, tau protein, alright, T, small t, I am writing, the way I am writing, just follow me my dear, yes. And next is management of Alzheimer's disease, alright, you see the Alzheimer's disease, the first bundle pack and second bundle pack of A, alright. Yes, the Alzheimer's disease treatment. We have already talked, right, I am saying the Alzheimer's disease treatment is doctor, that will be helpful, right, Dr. ZM. Alzheimer's disease, D for doctor, Dr. ZM, alright, what does it mean, right? So D for Donepezil, alright, just write it down, D for Donepezil, R for rivastigmine, R for rivastigmine, and yes, of course, Z for galantamine, alright, galantamine, yes. My dear, listen very carefully. So, donepezil, rivastigmine and galantamine are acetylcholine. Yes, these are acetylcholine esterase inhibitors. Acetylcholine esterase inhibitors. And another one is the receptor, that is NMDA blockers, or I can say the inhibitors. This is nothing but the memantine, alright, memory memantine, we can remember memantine. So make a box and I'd like to discuss a little bit more, alright. I'd like to discuss another important topic, right, along with that. Yes, so this is normal pressure hydrocephalus. Normal pressure hydrocephalus is a reversible cause of dementia, so certainly reversible, seen in elderly patients, and it is thought to secondary to reduced CSF absorption at the arachnoid villi. So these changes may be secondary to head injury, circle, and sometimes the subarachnoid hemorrhage, or sometimes the meningitis. So a classical triad that is seen in the urinary incontinence and dementia, and sometimes the bradyphenia and gait abnormality, very similar to Parkinson's disease. So the hydrocephalus is the enlarged fourth ventricle in the imaging findings, and management is the BP shunting, that is the ventriculoperitoneal, right, the shunting. So I'd like to give a box for the NPH, alright, so the SS box for NPH. So NPH, it will be helpful, right, normal pressure hydrocephalus. Just write it down, the normal pressure hydrocephalus is nothing but dark. So yes, this is important. So dark means, yes, the D for dementia, U for urinary incontinence, and G for gait apraxia. And the word itself says that the hydrocephalus, so imaging MRI or CT scan will show the hydrocephalus. And that's because you said that the treatment, the management is the ventriculoperitoneal shunting, so VPS. So this is the another box of investigations and treatment. So a further discussion will be helpful. Just follow me what I'm saying, alright. So let me start by here, alright, the box, the NPH, I say the NPH, alright, equal to that. D for dementia, U for urinary incontinence, and G for gait apraxia. So this is a reversible, this is important, reversible cause of dementia. Reversible dementia, because it's caused by the many other causes like the subarachnoid hemorrhage, sometimes, yes, the meningitis. So this is a very hot topic for the exam. So as because we have the P, and this P for peritoneal shunting can be remembered. And hydrocephalus, once again, this itself says that the hydrocephalus is imaging the diagnostic point, and P for peritoneal shunting. So I'm saying NPH dark the NPH. So once again, P for peritoneal shunting is the treatment, H for hydrocephalus is the investigation, and dark is the dementia, urinary incontinence, and gait apraxia. I'd like to discuss here the Alzheimer's disease. Yes, the Alzheimer's disease is autosomal dominant, but mostly are sporadic. So the rule of A's will be acting, say the A's are acting, you see the A's are acting. All are A's, how it is A's, alright, acting, you see the A's, alright, A, and A, how it is acting, you see. The starting to the ending points, the A's are acting. And Alzheimer's disease is, of course, you see the Alzheimer's disease, the rule of a amyloid precursor protein. So prezoline, presenline, PR will be helpful right here. So amyloid, just remember the word amyloid, and also the apoprotein, ELE, alright, so once again, A for amyloid, A for apo. That will be helpful, right. Then macroscopic, microscopic, and biochemistry. Macroscopically in CT and MRI, if you do the atrophy, cerebral atrophy means cortex, hippocampus, and microscopically we'll see the angles, alright, atrophy, angles, and A amyloid protein. Atrophy, angles, and amyloid protein. Yes, once again, angles are nothing but an AU protein, because this is tangle, so you can say this is tau protein. Must remember, alright. And you see the macroscopically atrophy, angles, amyloid, biochemistry, macro, micro, and biochemistry findings. And the treatment of Alzheimer's disease, we say the Dr. ZM must remember. And these are mild to moderate treatment, and if it is not working, then moderate to severe treatment. So that's why knowing these mnemonics of Dr. ZM, D for donepezil, R for rivaroxaban, Z for galantamine, and M for memantine. So M is the last one, so severe form using the memantine. So once again, the Alzheimer's disease treatment, acetylcholine esterase inhibitors and NMDA inhibitors. Sometimes the questions come up with the mechanism of action. So once again, A, NMDA. So M also memantine, it will be helpful. And first box, yes, let me start with the dementia, the Alzheimer's disease, AD, VD, vascular dementia, and LBD is the third cause, three causes, alright. Dementia diagnosis less than 24, the second box, and the third box is the dementia investigation, the primary care, all the functions should be done, and the secondary care, the imaging should be done, at least 2H should be excluded. That is subdural hematoma and normal pressure hydrocephalus. That should be excluded. And as because I already discussed about the right number 4 box here, that is Alzheimer's disease, and number 5 box here, number 6 treatment, and number 7 is an NPH. And the last box, because of I talked about the subdural hematoma here and normal pressure hydrocephalus, a small box of subdural hematoma will be helpful. This is box of the subdural hematoma, my dear. This is very important for your whole life. Just write it down, the subdural hematoma equal to alcohol means alcoholic, elderly, man with the fluctuating consciousness.
Best and the best and the best course ever you will experience in your whole life, my friend.
Diagnosis, the subdural hematoma. So if I say the subdural hematoma is nothing but fluctuating consciousness, this is the last box of subdural hematoma. Just remember, the alcoholic persons, elderly man having the fluctuating consciousness, yes, the subdural hematoma is the likely diagnosis. I hope that these all boxes will be helpful. As summary talk, the dementia, Alzheimer is the most common. Dementia diagnosis 24, dementia investigation primary and secondary, at least to exclude the SDH and NPH. NPH dark once again, and SDH is the fluctuating consciousness. And Alzheimer disease is nothing but the A for amyloid, A for apo, and macroscopically atrophy, angles, and also amyloid, atrophy, angles, amyloid. And treatment Alzheimer disease once again selective esterase inhibitors and also NMDA inhibitors. So Dr. ZM once again, D for donepezil, R for rivastigmine, Z for galantamine, and M for memantine. So I hope that, my dear, this dementia along with the Alzheimer's disease, along with the NPH as well as the SD, the correctable, too important, right, the secondary care. When you do the CT and MRI, you need secondary care, that should be done. And that is very good discussion. I hope that you enjoyed, my dear. Thank you very much.